Hi everyone, I'm Audrey, a former travel nurse who now works internally at Trusted Health to support other clinicians through their travel experiences. Today, we're diving into a topic that's crucial for all healthcare professionals to understand: nursing strikes. We'll explore what they are, why they occur, and how they impact various stakeholders, including travel nurses and allied health professionals. We'll also be sure to explain how a strike contract differs from a normal travel contract and how the Trusted Care team will support you should you find yourself on assignment at a facility when a work stoppage occurs. So before we dive in, go ahead and click that subscribe button to stay up to date on all of our latest content. Alright, so what is a strike? Generally speaking, strikes are organized events where workers, like nurses and allied health pros, stop working due to disagreements about work conditions, pay, or other employment terms. So more specifically, what is a nursing strike? A nursing strike is a coordinated work stoppage by nurses, often stemming from unresolved disputes between nursing unions and management. Common reasons for a strike include wages and benefits, safe staffing levels, work conditions, contractual agreements, and professional respect. In recent years, you may have seen that in September of 2022, 15,000 nurses in Minnesota staged the largest private sector nursing strike in U.S. history, highlighting understaffing concerns that were exacerbated by the pandemic. Another notable strike occurred in New York City in January of 2023, emphasizing the need to address short staffing on hospital floors. So who's affected by a work stoppage? When nurses and other healthcare professionals strike, it affects everyone, from patients, coworkers, the whole healthcare system, and the broader community. It's crucial for travel nurses and allied health pros to be aware of these impacts and take the time for introspection and evaluation of their personal stance when deciding whether or not to work through a strike. Travel nurses can decide to work a strike or participate in the work stoppage. They may already be on contract when a strike occurs at a facility, or they may seek out a strike contract. So what's a strike contract? A strike contract is a specific type of employment agreement used to hire temporary staff during a nursing or healthcare worker strike. It ensures that patient care continues even when the regular staff is on strike. While there are some agencies that provide very short-term strike contracts, Trusted Health does not. A strike contract is a specific type of contract that urgently fills the needs created during a work stoppage and ends once a strike is over. This type of contract is different from a normal travel contract that a travel worker might already be on when a strike happens to occur at that facility. At Trusted, we prioritize the safety and well-being of our clinicians when a strike does occur. We stand by our clinicians who are already on contract with us when this happens at the facility that they're working at. We offer support, clear communication, and safety guidance. A strike is not impromptu. A strike follows a declaration and a 10-day notice period, especially in healthcare settings. During this 10-day notice period, the facility determines how they will fill staffing gaps, and they communicate with agencies about arrangements to be made for any travel staff that's already on contract. Information is often not readily available at the time the 10-day notice is given, but Trusted Health will always share information with our clinicians as soon as information becomes available. The choice to work during a strike is deeply personal. It's all about balancing your commitment to patient care and your feelings about the strike. At Trusted, we strongly encourage introspection and informed decision-making. Our care team is here to answer any questions and support you every step of the way. Choosing to cross the picket line can bring anticipation of a tense atmosphere. You can also anticipate potential reactions from permanent staff in the community and possible staffing shortages on your unit. It's essential to have a support system in place, and you should remember that your nurse advocate at Trusted is always here to provide support. While most strikes are peaceful, it's important to stay aware of your surroundings, maintain a respectful distance from picket lines, and approach every situation with understanding and compassion. In most cases, facilities will arrange for safe transportation and specific instructions for entry and exit of the facility for clinicians who are choosing to provide patient care through a strike. It's important to stay in close communication with both your unit manager and your nurse advocate at Trusted to ensure that you always have the most up-to-date information. So when does a strike end? The length of strikes is completely dependent on how long it takes for the striking party and the employer to reach an agreement. Sometimes a strike may even end before it begins. This happens if an agreement is reached prior to the set strike start date. Once a strike does end, striking nurses and clinicians return to work, and clinicians who are there on a strike contract return home. Strikes in healthcare are multifaceted events that impact a wide range of stakeholders. Understanding the nuances is key, whether you're a travel nurse, allied health professional, or part of the permanent staff. Know that at Trusted, we're here for you. We offer guidance and support through these challenging times. Thank you for joining me today. If you have any questions or need guidance, feel free to reach out to your care team at Trusted Health or drop questions for us in the comments below. Remember that we're stronger together. We're always aiming for both the best in patient care and your professional well-being. Don't forget to like, share, and subscribe for more informative content. See you next time.